that you are while you're doing this, the more you're going to stay up on top of these little, I see that, and so you're getting points every time you jump onto a mini. Okay, so now you're all okay, what you're going to do is you're going to see words, red, blue, yellow, and black, but they're going to be written in a different color ink. And you want to say the color of the ink, and it's got a voice recognition thing in it, so...
Color of the ink, not the
right.
color.
Yeah,
Thank you for coming out on this rainy day. I'm Robin Strongin with Amplify Public Affairs and the creator of the Disruptive Women in Healthcare blog. And it really is a pleasure to have all of you with us today. I'd also like to acknowledge and thank the Hill newspaper for serving as our media sponsor and helping to make today such a successful program. The blog was launched back in September on the 25th, and then 4 months later it was named one of the top healthcare policy blogs, along with such august blogs as the Wall Street Journal Health Affairs and the Mayo Clinic Health Policy blog. I'd also like to add that the healthcare blog was also on that list, and Matt Holt is with us here today, and so we're in very good company all the way around. There are 29 Disruptive Women bloggers, and we are a very diverse group. And I use that word meaning we're diverse in every way. The blog itself was not designed to lean one way or the other politically. We are Republican, we are Democrats, we are conservatives, progressives. We represent all kinds of healthcare expertise, physicians, scientists, nurses, business women, and so forth. And in fact, equally important, if not more important, we really did seek out others from outside of healthcare, because I feel very strongly that it is not enough to be an expert within the healthcare sector, but there are plenty of lessons to be learned from outside, both good and bad. And so we're delighted that among our bloggers we have women from the telecom industry, from Microsoft, from Google, and from other industries where we could learn and work together. And today's briefing, which is our first, hopefully the first of many that we'll be doing, really the idea of health gaming nicely tees up this idea that there are a lot of different industries and lessons that come together. And so with this briefing, to help us figure out how supporting the stimulus goals as it relates to healthcare, what in the world does health gaming have to do with that? And when you look at two of the stimulus goals in particular, the first, accelerating the adoption of health IT systems, to me, inside of the Beltway, we think of health IT as electronic health records. As being disruptive, I would argue that there's a much broader definition that we should be considering, and one of the items within the definition of health IT, health gaming. And the second goal within the stimulus is making, and this comes right from the White House, by the way, making the single largest investment in prevention. And obviously, given that 1 in 3 adults, not to mention children, suffer from at least one, if not more, chronic diseases, the stimulus plan does tackle such health issues and challenges as obesity, diabetes, smoking, and other health-related risks, and so too healthy gaming. And to help us sort through all of these issues, I'll be joined by several extremely disruptive women to my left, starting off with the Honorable Nancy Johnson, who will open for us and share her interest in HIT and really the fundamentally disruptive nature of personalized healthcare and patient involvement. She will be followed by Dr. Glenna Crooks, who will inject some policy reality and bridge the discussion between the fun and excitement of health gaming and what are some of the realities when we get down to the politics, the policy of payment, reimbursement, access, and other challenges that we all face when we're dealing with healthcare issues. Julia Lochran, who is an accomplished gamer, will discuss how e-health games can fill vital gaps in the effort to improve healthcare quality and the importance of prevention. And I do want to point out that improving healthcare quality is not unique to patients, and in fact, healthcare providers and caretakers have a lot to benefit from healthy games as well. And then Janet Venturino will discuss Kaiser's video game, The Amazing Food Detective, and you should each have a copy of that in your folder, as well as the bios of each of the panelists up here with me. And this Food Detective CD was developed and based on a character created in Kaiser's educational theater program. After we hear from all of our panelists, we'll take some questions and then we're going to let you go and play. And before we do that, I would like to acknowledge two people, Charlotte Sappos and Doug Goldstein. Doug is here in the blue warm-up suit. Doug is many things. He is a leading health strategist, an author, an e-futurist. He's the president and CEO of iConnecto, but most importantly, he is the Disruptive Women April Man of the Month. And we have started a new feature. Every month we do highlight some extraordinary male that has contributed to health policy, and this month, in honor of all the work we've been doing around health gaming, who better than to personify it than Doug himself. And I have to tell you guys that every single man that we've approached to be a man of the month has asked if they can keep their clothes on. I will leave that right where it is. I'm not going to touch that one. And then Charlotte comes to us from Anthrotronics and AT Kid Systems, and she has brought several games with her as well. And after, I would encourage you to ask questions about the games and the work that they're doing there. So without further ado, there is further ado. I would be remiss if I didn't thank Congressman Elliot Engel from New York, whose wonderful staff helped us with the room, and Jose Guzman from Amplify, who's been outside and helped us tremendously with all of the logistics today. So with that, welcome everybody, and I'll turn it over.